since I first got notification of it. Jane Hunt to move the motion. Jane Hunt.
Thank you very much, Mr Casey. I beg to move that this House has considered proposals to manage asbestos in workplaces and introduce measures to prevent the public's exposure to asbestos. It is a pleasure to serve under your chairmanship, sir. I would like to thank Mesothelioma UK, a national charity based in my constituency, for their work supporting those living with the asbestos-related cancer, as well as providing access to mesothelioma clinical nurse specialists at the point of need in hospitals across the UK. The charity offers a range of support services and dedicated research. I would also like to thank the House of Commons Participation Digital team, who, ahead of this debate, helped me create a public survey on the issues I'm going to raise, as well as the very many people who shared their experiences through this venue. Earlier this month was Global Asbestos Awareness Week. This Awareness Week is crucial to Mesothelioma UK, who have said that they consistently receive feedback from patients, families and professionals that the public should be made more aware of the risks of asbestos and that action should be taken to ensure that deaths from exposure to it are prevented for future generations. Currently, there are 3 hazards considered dangerous enough to have their own regulations: radiation, lead and asbestos. While lead and radiation are now strictly controlled and as a result account for 0 deaths, the continuing low profile of asbestos in public policy is putting the public in danger. This is supported by the mortality statistics, which I will go into shortly. Asbestos is a naturally occurring mineral extensively used as a building material in the UK from the 1950s through to the mid-1980s and found its way into products like ceiling tiles, pipe insulation, boilers, sprayed coatings and garage roof tiles. Given that it was often mixed with other materials, it can be difficult to determine its presence. There has also never been a wide-scale investigation into exactly how many buildings contain asbestos. We therefore can only go by the estimates produced by various organisations when trying to determine the extent of its presence. One such estimate is from the Health and Safety Executive, who believe that between 210,000 and 400,000 buildings in the UK can contain asbestos. However, other sources say that about 6 million tonnes of asbestos spread across approximately 1.5 million buildings, the most asbestos per capita in Europe.
Would the Honourable Lady give way?
Certainly.
Margaret Ferrier.
I thank the Honourable Lady for giving way and congratulating on securing this debate this afternoon. The Working Pension Select Committee criticised the Government and the HSE for a lack of imagination in working towards wholesale removal of asbestos in non-domestic buildings. Does the Honourable Lady agree that the HSE should be funding research in order to inform a wider credible strategy for wholesale removal?
Thank you very much indeed for your intervention. I would certainly agree that there's work to be done there, absolutely, and that sounds like a very good idea. The chairman of the Select Committee is going to be speaking, I believe, a bit later on. Freedom of information requests to the Department for Education last year found that nearly 81% of schools reported that asbestos was present in their buildings. The responses to my survey indicate that schools are indeed one of the hotspots for asbestos exposure, with one response stating, "My lovely mum was a primary school teacher who taught children with special educational needs. She was 64 when diagnosed with mesothelioma and 67 when she died. After investigations, she was asked if she'd ever worked with asbestos. She said no. It was an odd question as she was a teacher. Then we found out that asbestos is still present in UK schools today." Certainly, absolutely.
Martin Doherty Hughes.
Congratulate her on getting this very important debate. Would you consider the idea of forcing educationalists, whether it be teachers or lecturers, being forced to sign NDOs not to discuss asbestos in their establishments on their leaving their institutions as an affront and should end?
Okay, I wasn't aware of that. Thank you very much indeed for your intervention. Perhaps I can put that to the Minister to see if she could respond. If not, I'll try and get a response back from the Department for Education for you. There was another stating, "My husband was diagnosed in October 2012 with mesothelioma at the age of 34. It changed our lives forever. We do not know exactly how or where he was exposed to asbestos, but from research, we believe he either had secondary exposure from his father bringing it home on his clothes from his place of work, or he could have been directly exposed in the schools he attended, which all still contain asbestos to this day. Separate information requests to the NHS found that more than 90% of hospital buildings contained asbestos. Hospitals were also identified as another hotspot for exposure in my survey, with one response stating, "Before her 40th birthday, my wife was diagnosed with mesothelioma, a mother of 3, who for her whole life worked as an NHS nurse. She was studying and working in what you would expect to be a safe environment." A further Freedom of Information request to 20 local authorities across England, Scotland and Wales from the law firm Irwin Mitchell revealed that 4,533 public buildings still contain asbestos. This averages to around 225 buildings per local authority. Irwin Mitchell estimate that if the data provided is repeated around the country, there are around 87,000 public buildings containing asbestos. Asbestos exposure is the single greatest cause of work-related deaths in the UK, with the HSE estimating that more than 5,000 people die from asbestos-related cancers every year. More than half of those deaths are from mesothelioma, a type of cancer which can occur on the lining of the lung or the lining surrounding the lower digestive tract. Shockingly, according to the HSE, the UK has the highest rate of mesothelioma deaths per capita in the world. Mesothelioma is not typically detected in the early stages of the disease, as it has a long latency period of 15 to 45 years, with some prolonged cases of 60 years before symptoms show. Therefore, once diagnosed, it is often advanced, and so up to 60% of patients die in the first year after diagnosis, with just over 5 in 100 surviving for 5 years or more. Furthermore, while historically men working in building-related activities, as well as other heavy industries such as shipbuilding, were the most likely people to develop asbestos-related diseases, we are now seeing a trend of younger people, both men and women, dying as a result of exposure. In addition, as Irwin Mitchell have highlighted over the past 20 years, there has been an increasing number of people developing asbestos-related illnesses from more indirect sources, such as Yes, of course.
The historical legacy of asbestos, as she mentioned, in heavy industry is well documented, but does the member share my concerns and that of the Clydebank Asbestos Group, my constituency, about the increasing number of women being diagnosed with asbestos-related conditions, critically reflecting the reality of women's exposure due to a failure to recognise the many types of asbestos-related conditions which can also relate to ovarian cancer?
Thank you very much indeed for your intervention. I wasn't aware of the ovarian cancer element. However, I was going to go on and say, such as family members perhaps washing work clothes, that kind of thing, covered in asbestos dust, or non-industrial exposure. So this is greatly concerning. I would like to take this opportunity to share a few extracts from a statement provided to me by one of my constituents, whose husband died from mesothelioma after being exposed to asbestos. My husband at first did not show much reaction when he was diagnosed. All he really wanted was to find out what could be done to help him. He felt angry later that it could have been prevented. My husband was very matter-of-fact that all he could do now was fight it and try to survive as long as possible. I felt absolute terror. I felt extremely upset and tearful because my husband was handling it so well. I kept some of my worst feelings hidden and just supported him in the way he wanted me to. But I felt an overwhelming panic that I was going to lose my wonderful husband to this devastating cancer, something that was totally preventable. Rightly, there have been a number of regulations introduced in the last 90 years to try to limit people's exposure, including a full ban on its import, supply and use in manufacture in 1999. The government's current policy reflects HSE advice, which states that, wherever possible, asbestos-containing materials should be left in situ. The Control of Asbestos Regulations 2012 provide the regulatory framework on working with asbestos and apply to all non-domestic premises. Under the regulations, the HSE requires duty holders to assess whether asbestos is present in their buildings, what condition it is in, and whether it gives rise to the risk of exposure. The duty holder must then draw up a plan to manage the risk associated with asbestos. Importantly, this must include the removal of the asbestos if it cannot be safely managed where it remains in place. Duty holders are also legally required to remove asbestos-containing materials before major refurbishment or demolition work. Despite these efforts, asbestos is still present in many buildings and people are still suffering and dying from asbestos-related illnesses. We therefore need to take a look at what more we could do. I welcome that this is something that the Work and Pensions Select Committee has recently considered as part of its 2022 report into the HSE's approach to asbestos management. I note that the chair of that committee, the Honourable Member for East Ham, is here today, and I would like to thank him for his dedication to highlighting this very serious issue and for his support and assistance with this debate today. I am sure he will want to speak in more detail about the findings of the committee's report. However, I would like to mention two issues which were raised by the committee and which Mesothelioma UK have highlighted in their new campaign, Don't Let the Dust Settle. The first of these is the committee's recommendation that a central asbestos register be introduced. The lack of an in-depth and up-to-date data is proving to be a barrier to dealing with the risk it poses to the public. A central register would help alleviate this problem and support a longer-term strategic approach to managing asbestos. It would also provide vital information on the level of compliance by those with a duty to manage asbestos in their premises and ensure that enforcement action is focused in the right areas. As one respondent to my survey put it, the existence of asbestos in public and private buildings is rife, yet there is no proper cataloguing of this or scheme to remove this highly dangerous substance. The hospitals caring for people with asbestos-related cancers are full of the very substance that is killing them. There is a need to systematically catalogue and schedule a programme of removal of asbestos from all buildings. Without a register and steps being taken to remove asbestos, the British Occupational Hygiene Society estimate that we are likely to see a spike in occupational and potential non-occupational illness arising from asbestos exposure in around 2060. I would therefore be grateful if the Minister could please reconsider the Government's position on a national register. The other recommendation from the committee is that a deadline be set for the removal of all asbestos from non-domestic buildings. This approach would bring our strategy in line with that of France, where a general plan has been implemented to remove asbestos from every building within 40 years. Under the Health and Safety at Work Act 1974, the UK is obligated to seek out and adopt international best practice. Currently, the classification of acceptable exposure levels to asbestos fibres in the UK is 10 times greater than that now allowed across Europe. The current way of dealing with asbestos, to leave it in situ, is clearly not working, given that the people affected by asbestos-related cancers are becoming younger and younger. Materials are degrading over time through wear and tear and being damaged inadvertently. Research by the Asbestos Testing and Consultancy Association and the National Organisation of Asbestos Consultants, published last year, identified that over 70% of asbestos-containing materials managed in situ had deteriorated, indicating that the management of the risk was ineffective. We therefore simply cannot afford to delay its removal further. This is particularly true in education and health settings, where many of our most vulnerable stay, work and study. The majority of those who have contacted me ahead of the debate are in agreement that, in order to deal with the current risk, we need a national asbestos strategy. This approach has already proved effective in other nations who accepted that leaving asbestos in situ is not safe. Indeed, since developing national asbestos strategies, these nations have seen an improvement in their asbestos monitoring and detection technologies and practices. The UK needs its own asbestos strategy that incorporates this best practice, as well as a timetable for the safe removal of asbestos, prioritising the highest risk asbestos from settings such as schools and hospitals. Taken together, these two actions will help focus minds across government and industry and help drive progress forward. Finally, I would like to close with extracts from a statement provided to me by another of my constituents, whose husband died from mesothelioma after being exposed to asbestos. Her husband said before his death, "I was never told about any risks of working with asbestos. The environment was so dusty that sometimes you could struggle to see clearly. It was therefore obvious to me that health and safety was being ignored." She later said, "My husband was 69 when he died from mesothelioma. We had been married for 45 years. He was a family man who always put others first. His death from this terrible disease has deprived me of a loving husband and friend, his daughters of a wonderful father, and my daughter's children of an amazing granddad." The grandfather of one of the members of my own team died from mesothelioma. We must put a stop to this. Please, don't let the dust settle. Thank you.
Thank you very much. 1, 2, 3, 4, 5. Thanks, colleagues. You may be seated.